welcome everyone to this session with Zayna, smashing the barriers to innovation in healthcare. Does it take a pandemic? And it will be a very interesting session with Zayna, who has a very extensive curricula in innovation and health. She is future strategist at St. Elizabeth Healthcare, a major Canadian social enterprise in seniors health and home care, faculty at Singularity University in the exponential medicine stream, adjunct faculty in health sector strategy at the Rotman School of Management and at the University of Toronto. And I leave you with Zayna.
Thank you. Hi, everyone. I hope your conference is going well. It's very early here in Toronto, Canada. So I lead the Futures team, which is a very kind of Horizon 3 focused innovation team for a very large, very old Canadian organization in healthcare. As you can imagine, we've been very busy dealing with this health crisis. And so it's been fascinating in our industry how very quickly, these barriers, which I show on my opening slide here, to health innovation, which have really stifled our ability to move at the pace that patients and clinicians want us to move, they've really fallen down. And I think probably more than any other industry. So I'm going to reflect on that, and hopefully that there could be some inspiration or validation of some of your experiences. So in our work, planning for how we're going to respond and adapt our innovation model in healthcare, we've done a lot of time looking back to say, what happened in other similar global crises? What are some lessons learned, and what could we do to adjust our innovation model to maybe anticipate some of the behaviors or patterns that nobody would have expected coming out of some other big crises where the focus of everybody was dealing with the crisis. And, although a lot of times when the world goes through something big, we have big statements that we think, for example, the world war is going to be the end of all wars, or that things will, financial regulation will change significantly when there's a big crisis. A lot of times those things don't play out. But certainly there's an explosion of innovation on products, social policies, and services. So, when we look back at the plague, which is the closest thing to what's going on, which decimated 1/3 of Europe, many will credit that event with the end of serfdom, the end of, serfs and the urban poor and the rural poor being slaves almost to their nobility masters. And that's kind of a lot of what's going on now, where we're realizing, when a plague takes out your most essential workers, society can't function. And so lots of lessons learned there about how to embrace that wave. World War II, had a lot of things that came out of it. Women participated in the workforce as a result, which nobody really expected. Government had to really step up its spending from, today we spend 4 to 8% in most countries as government in the GDP, to over 40%. And that's exactly what we're seeing now. And then just an explosion of product innovation that helped, one set of people beat the other set of people because they out-innovated them on products like jet engines and computers and the internet. So all these came to society and really kind of turbo boosted our progress while also emerging from a crisis. 9/11 has a lot of similarities in that pretty much overnight, how we travel and security changed. So, you'll remember what it was like to go to an airport the first time they opened up. That's very similar to what we're seeing now in all of society. And then, overnight, our own behaviors and attitudes around privacy and security were shifted kind of forever. And I think we're going to see a lot of that now with surveillance coming out of this crisis. When SARS hit, we here in Toronto were probably the second big epicenter, but nothing like what happened to China, where people couldn't go buying stuff at stores anymore. And that really is credited for opening up e-commerce. And, Alibaba, I often say, in China in 2003 is like what Zoom is for us today. It just paved the way for that giant and many others. And then, the financial crisis, because jobs were decimated, really gave way to the marketplace economy like Airbnb, the gig economy, and Uber and Lyft and TaskRabbit, and showed that government can make policy really, really quickly. So The point is, I think, we can't ignore this if we lead innovation, that you got to harness these opportunities and ride the waves and adjust your methods to be fit for purpose. And that's what we've been trying to do in healthcare. So the journey we were on pre-COVID in our industry of healthcare was a pretty paradigm shift in the whole architecture of why do we even have a healthcare system. Most systems of healthcare, so the institutions that regulate it, that train health professionals, and of course that deliver care, were built largely post World War II, but based on 100 years before that of systems of medicine that were centered around one paradigm, which is the system, the buildings, the payers, the clinicians, and that worked for us for a while. But now that people are alive a lot longer, accumulating complex diseases, and have all the same information that the highly trained professionals of the health system do, that paradigm is shifting, just like every other industry, to the citizen, the patient, the user, the family member, the taxpayer who finances the system, or the employee who pays for their health benefits. And so as that shift happens and power moves to the ultimate beneficiary of healthcare, that's challenging pretty much every assumption of healthcare. And that's where innovation comes in. And so in our world, what's driving that, really a pull to the future and also a push out of the old, because the business model isn't working, have been three big forces. The first, as I mentioned, and this is reflected in a title of a book that's really seminal for our time called The Patient Will See You Now, by Dr. Eric Topol, this power, I don't know what the word is, revolution of patients and their families who have all the means of production, who have knowledge and are very motivated and have come to get power in every other industry. They can book their own travel, they can do their own stock trades, they can buy whatever they want, whenever they want, wherever they want. And that really has not been an option in healthcare. It's been really, one way and one way only, which was designed by the system. So that force is pulling us to the future. You layer on top of that a second force, which is we're out of money. There's no healthcare system anywhere in the world that, either has enough cash to keep paying to do care the way it used to do it, and meeting the needs of the population, or in some countries that are flush with cash, there's just no way they can recruit, train, and deploy the health resources, the people, to deliver care, because our industry continues to be a very labor-intensive industry. And so, China or Saudi Arabia or some countries in Europe that don't need, tax base to finance healthcare, or other places, they're still not going to be able to get the talent because we still use labor to do a lot of things that labor doesn't need to be doing. And so when you're out of money, or when your business model is no longer working, and we've really had one business model in healthcare, it's time to rebase. And then finally, we built our systems of healthcare when digital certainly didn't exist, and very, very few technologies existed. And so we assumed a lot of things, and those have been very difficult to take out of the institutions of healthcare. And so you have three big things that have been coming together, and all of us in innovation and healthcare have been riding these waves to kind of get us to the future and systematically destroy, or creatively destroy, the old and put it back together to the new. And so what that started to look like, and the journey that health systems around the world was on, I kind of characterize into these 6 shifts. From a reactive paradigm of healthcare, which is a sick care system, because when we built our healthcare systems post World War II, everybody was pretty young and healthy. So we built it to be there if something goes wrong, not to be there to keep you healthy and to promote health. So all that is now shifting to be preventative, proactive, and even predictive using AI and tools. A big shift of precision or personalization from a pretty crude, very analog, one size fits everybody, which means one size fits nobody model, to highly personalized, intelligent, stratified, really like a data and intelligence-driven model, instead of some mix of art and science that depends on the clinician. The third shift, which is a big one in healthcare, is a channel shift. So the channel through which patients get services has been mono-channel, largely institutions. So you go to the care instead of omni-channel, like it's happening in every other industry. A shift from episodic and intermittent to much more continuous, because we have sensors and monitors and we can flow data in a way we couldn't before. A big power shift of who's making the decisions, from the provider of care to what I call people-powered healthcare. And then finally, a big business model shift. We've had one business model for 150 years, which is fee for service, pay for the pill, pay by the visit, pay and measure the inputs and the costs of healthcare. And we finally, because we have the data, can actually orient a business model around the results. So this has been massive change. And this, our industry of healthcare improves through a methodology of kind of quality improvement. You can't quality improve yourself to the right side of this page. This is innovation. This is rebasing, and it's been painfully slow. And then enter COVID, and all these forces now get very much amplified. Overnight, a behavior shift in patterns of patients and their families, trying to manage this risk of personal contact. Overnight, the supply and the demand of a lot of things just threw out of whack. Products like vents and tests and sanitizer and personal protective equipment, but also policies that make no sense in response to a pandemic. We needed to be drummed up overnight. And then now all of a sudden, technology, which was in massive supply on the innovation side, we had a lot of tech companies and big tech giants, and even our industry of medical technology pushing new tech into the system, and the system unable to absorb it. Now all of a sudden that's in massive demand because the tools we had weren't going to serve. And so, I'm sure there's been many times in this conference of showing, the Rogers diffusion curve, the S curve. And, those of us in innovation, before we even get on the curve of adoption, is all of our blood, sweat, and tears to design, test, prototype a new product or service or business model. And then, the hardest part is that first 30% of adopters. Well, that entire curve shifted very quickly in all places, but certainly in healthcare. And the debate now is, just go back. We're going to, we did all this for this, but now we're going to go back. And I fundamentally don't think that's what's going to happen. And that's certainly not the signal, at least in my industry. And more importantly, for the first time ever in our industry, our innovations in healthcare are the most high demand concept in the world, because the gateway to reopening society and the economy is innovating in healthcare. And so it's a very exciting time to be in innovation in healthcare, not just for our own industry and our patients and our clinicians, but really for every industry. And so kind of the headline of my chat today was around these barriers to innovation. And, these have been a brick wall for us in innovation. Things don't just move, slowly, they move glacially in healthcare because we have a lot of things stacked against us that make it very difficult to take apart the old and bring together the new. They've really been smashed overnight, and that's opened up a lot of channels to do things very differently. And the big insight, I think, for those of us who are in the industry who thought these barriers are going to never go away and it's going to be very hard, is it really proved that what we thought were barriers actually weren't real barriers. They were perceived barriers, because at the end of the day, we were able to do it in a lot of cases. Now, I'm not going to read this slide, but I've been keeping an inventory of this proliferation of innovation in healthcare, where decades were achieved in a matter of days, and that's kind of along a lot of fronts. The biggest one I'd say in healthcare absolutely has been the ability for a patient to access care services that's decoupled from time and place. In our world, we call that digital healthcare. That just wasn't allowed, or was not a common practice in most industries or most places in the world. And that just opened up overnight, including policy change to reimburse. But lots and lots of stuff in our own industry. And then, more excitingly, every other industry stepped up and came and helped out our industry. So they all kind of had business models that couldn't work. Manufacturing had nothing to make because nobody was buying their cars or their bags or their clothing or their beer and wine. And so they kind of retooled and pivoted very, very quickly to bring solutions into our sector that we desperately needed, and gave other industries a chance to check out healthcare. And everybody's been interested in coming into our sector, and then just lots of new types of solidarity. So, if I do an audit of how quickly these shifts in healthcare that we've all been innovating against materialized, or were accelerated, and this is like a global weighted average from what we see around the world, I think some of these shifts definitely did get faster. The biggest one, no question, is the channel shift to having choice for patients to access care, because the most dangerous place to go is a facility, especially when you're sick. But other fronts around data, around tracing, tracking, testing, product innovation like vaccine development have moved. Other areas, I think we went backwards or we stalled. We did not actually empower patients and families. If any of you know somebody in a hospital or a nursing home, they're not allowed to see their family. Well, that's exactly the opposite of people-powered healthcare, and nobody's really touched the business model. So all to say, back to our curve, I think those of you in innovation, you have a responsibility and a duty to get a mindset around, this should stimulate you to not only not want to go back, but to want the future sooner and take advantage of these opportunities. And, the opportunities abound. I mean, every one of these major crises created a new type of economy, right? And I would say this one, because this is the first crisis that touches where every single citizen in the world is aligned on one problem. So we're now in the pandemic economy. It's a composite of every one of these other economies. So the playing field has completely changed for everybody. And this is really massive opportunity to take your skills and tools and create the future. Thank you.
Thank you very much, Zayna. We have the Q&A open for you to set your questions. The presentation was really very interesting, integrating many aspects of economy, society, technology, health, obviously. And while we get the questions, I would like to ask you about the role of the different barriers that still are there, and which were the most important barriers in your opinion. It has to do with people mindset, has to do with policies and the government, has to do with the market itself. I don't know, which were the most important barriers? What are the barriers that still remain there?
So, all the barriers are in theory there. Mindsets is the top of my list, absolutely, because if you unlock mindsets, you open up every other barrier. And so I think, that's the one that I think in some areas we move fast because we had no choice, like virtual care, but other things didn't. Actually, mindsets retrenched. Like I said, treating family members as a visitor, not as a partner in healthcare. Mm-hmm. So to me, mindset is it. I spent a year on secondment in the Netherlands working for the Dutch government. I built a health innovation school. I co-founded it. And all we focused on was mindsets, because everything else, what's your innovation process? How do you do policy innovation? That can be figured out. But changing how people think is the lock and the key to opening up innovation, in particular in healthcare.
Yeah, very good. We have here another question. How do you think of this pandemic economy will influence researchers in health innovation?
Yeah, so I'm a scientist by training. I'm an academic. I have a PhD in biochemistry. And I've said many times, if anybody at this point in their life is thinking of doing a PhD, this is the time. There is so much to now not only study and understand and codify, but so many new research questions open up that are vital to the innovation agenda and just the policy agenda of healthcare that I don't think we can have enough brilliant people interrogating. So I think the whole agenda for research has shifted overnight. And then the methods of research. I just gave a talk about this for Canada's national health research community. The old way of, waiting a long time, getting data, studying it, writing a paper, publishing a paper, and then 2 years later, policy changes or practice changes, that's done. Data is abundant. It's real time. It's developmental. So just the methods of research need to also adapt to be fit for purpose.
Thank you very much. We have one more question here. How do you think of this pandemic economic? Well, no, this was the same. This was the same.
No, the other question there about the hospital landscape. So if you think about the shift I talked about here about the channel, right there. This basically means, the headlines will say the end of hospitals, right? I don't think hospitals will go away. They will always have a role, but their role is supposed to be acute care, which means urgent things that need the equipment and of a building like a hospital, like a heart attack, brain surgery. So it's ER, OR, operating room, and ICU. That's all a hospital needs to be. The rest will go out. And that's like 70% of what hospitals do today. So their footprints will go down, their real estate, their parking, their buildings, their bricks, their mortar. Are hospitals just going to let all that go away? No, they're reinventing their business model to be decentralized and out. And that's no different from what a mall or a retailer is now doing, to have a blended kind of physical digital experience. I think it'll be accelerated though, because patients do not want to go to hospitals anymore. Too risky.
How do you think of the artificial intelligence in healthcare?
Yeah, I mean, AI is just going to be an accelerant to all the shifts, but definitely the second shift shown here of precision, and it'll also help us replace a lot of labor with technology so that our precious, precious humans who do healthcare can focus on what a human can do the most: empathy, compassion, touch, and all their cognitive things that a machine can do better will go away. We have some doctors who talk about spending 60% of their time documenting things. That should go to zero with AI. And so it's going to be a game changer if done well. But we often say AI is like electricity to humanity. It's the next biggest human invention. And if AI is electricity to humanity and society, in healthcare, AI is like a little light bulb in a hut on an island. I mean, we are barely starting embracing this technology in our sector, but it will be a big help.
We have here fee for health is an interesting concept. What's going to see this change in business model within healthcare? Has the pandemic helped?
Yeah, so no, as I showed later, I don't know, at some point in my audit of has the pandemic helped, I don't think it's helped this at all. It's the one area that is, the holdout, I think, in health innovation, because there's some very strong producer interests that want to hang on to a fee-for-service model. That's also policy. So the shift is going to be that our business model is broken. I mean, when you can no longer deliver care to the people who need it because your business model forces you to ration that care, because on a fee for service, you've got a budget, you're paying by activity. And when the budget runs out, sorry, the next person either waits, that's what waiting lists are for, or just doesn't get it. And so when you now are saying, no, I'm only going to pay when I get the result I want, which is health, then I'm not wasting a lot of money on fee for service. That's making a lot of other people very wealthy, by the way, but I'm not getting my result. And governments are sick and tired of being sick and tired of paying for things that don't produce results. And now that we have data that can allow you to measure the result in real time, and before, we couldn't do that. We had to wait 3 years to get the data on an intervention we did, 3 years ago. So it's going to become easier, and that will be the source of competitive advantage for a new entrant like a startup or Amazon or Apple or Google, because they can come in and say, you don't need to pay me until I show you the result, and they can measure the result. And I think that's going to very quickly disrupt the incumbents who are unable to evolve their business model.
Great. What will be the new way of collecting data and publishing papers in the future?
You know, papers are going to be like an interesting thing, just like, you know, going to school and getting a degree. Like we all do it, but we know where the learning actually happens, right? So you'll do it because you have to. But if, you know, the goal of research, particularly in healthcare, at the end of the day is not to publish a paper, it's to advance health and inform knowledge about health. That's going to be what's going to be rewarded. That's why people are getting into research. I mean, frankly, that's why I left academia. I felt like the whole system was not designed for impact. And so it'll be real time. It'll be developmental evaluations. It'll be very, very data informed. And, you know, research and even education will now happen at the point of care instead of, you know, in a big ivory tower. So it's a fascinating time for the research enterprise when we now are, you know, exploding in data in healthcare, and the data is being generated by a lot of new sources, what I say extracellular to the formal healthcare system. So your Fitbit and your sensors and so, you know, when 7 billion people get online in the world, 7 billion people will now interrogate healthcare data. And so I think it's just going to be a fascinating time for research, and it's going to really disrupt that entire enterprise.
And well, we have a new world. Data will be very important, and some new concerns can rise here related with data and privacy of health information, personal health information. I mean, this is a threat in the new model, but that I can imagine. But maybe you have ideas or other points or other issues that could appear in the new model.
I mean, like everything, every innovation is, you know, what we say is a two-edged sword, right? You know, fire was the first innovation of humans, and it can keep you warm and it can cook your food, but it can also, you know, decimate an entire forest or uproot a whole society. So there's always unintended consequences. And, you know, the one methodology of healthcare that I really like that I don't think we'll ever lose is, you know, we're evidence-based. So when a new thing comes, a new pill, a new care model, a new whatever, the methodology to decide whether or not we should embrace that new thing, pay for it, and roll it out to patients and clinicians is what we call health technology assessment, which is a whole way to say, what is the net pro and con? So if the net benefits are better than, you know, the net benefits over losses of the old way of doing things, it gets approved. And so that's basically what you have to embrace and be ready for. And again, that's where research and data becomes really important, because if an innovator cannot show and demonstrate very cheaply and easily the benefit of whatever they're doing, then it won't get funded. It won't get adopted, because healthcare is very difficult to change. And so the bar is so high to take out the old and bring in the new that you better have some amazing data and make it very easy to measure.
I have a question here. How to define the value in healthcare?
So value is pretty simply put. There's a great book by Michael Porter. He's a business scholar that everybody who's a smart person in business has, you know, tried to kind of come help healthcare out a lot. And he's one of them, a Harvard scholar. It's basically the result you get divided by the cost it took you to get that result. So outcome divided by cost. That's value. And what we've done in healthcare is we've obsessed, and that's the sixth shift on my slide here. We've obsessed with the cost part. We've optimized the cost. We've rationed the cost. We've measured it, and we kind of assumed the outcomes were there without measuring it, because it's very difficult. It has been, and so now value is outcome divided by cost. The two levers are getting a little bit more equal weighting, and competitive advantage, success will accrue to the people who can do that, who can measure value. And we're professionals at measuring cost, particularly the incumbents. And that's why healthcare, is very ripe for some new entrants to come in and create value and measure it in a new way and take the value.
Extraordinary, Zayna. Thank you very much. We are running out of time, and it was an extraordinary presentation. And thank you very much for sharing your knowledge, experience, and vision with us.
Thanks for having me. I hope you have a great conference.